The agencies that care about patients, I want to do everything I can. Like, I'll reduce my fees to help them. I want them to win in every single marketplace. That alone could make such a big impact on our elderly community, which is the most overlooked and vulnerable part of our community. If we can help the agencies that care to care for more patients, that to me is like a purpose. I could get behind that and have all of my assets, all of my strengths directed in that direction. That's when it'd feel great to know that I made a positive impact on elderly people in our country.
Hi, everyone. My name is Mariam Treystman from the Home Health Consultant, and today we have the pleasure of having Austin Degenhardt, Managing Partner of HHA Pros Consulting. Thank you so much for joining us.
Well, thanks so much for having me on.
I really find your system fascinating. I think it's cool to focus on this specific aspect that generally people don't really focus on. Like when people can think about home health, the hospital, not facility, but like in-home hospice marketing, they're really just introducing themselves to as many facilities, doctors, whatever referral sources as possible, hoping they're going to get a referral. They're doing their best to differentiate, but you can't really differentiate by law. Like it's just this required same service. And so it's cool to have a focus on this area when there's so many regulatory based focuses on everything else. Like CMS does a really, really good job on making you pay attention to the important things in healthcare, thus neglecting anything else. I mean, it's just kind of how it works. So what have you seen? Like, okay, you were in this, in the agency, you did this in the agency. How did you decide to essentially like make it your own thing? Or
Yeah, that's a great question. Basically, after we built this software out and we saw what the results were over about a year, basically, I think I already walked through what the admission percentage differences were, right?
like 75 to 15.
Yeah. But the thing that really hit me was it was Q4 of 2024, which is generally a lower referral.
Yeah, everyone's on vacation.
Volume. But that's when we hit our highest admission number. So the referral number dipped, the admission number went up. We had our highest census ever in a Q4, which had never happened before. And it was just because of the growth of the admission rate. Just because we had become more efficient and effective at managing our referral to admission process. And once I saw that, for me, I really want to make an impact anywhere I am. And some people are really suited to management and to managing a day-to-day process. And thank goodness for them, because companies wouldn't operate without that.
Yeah.
But for me, I don't know if it's the way that my brain works, but I like to come in and identify a process that is like, I can just see the way something works in a process or in a system, and I can find the inefficiencies, and I like to fix it, get everyone trained on it, and then remove myself from it and call me when the next problem happens, which is, I think I'm outlining what a consultant does. But and I've always sold in that manner, in a consultative manner. If you don't have the problem I'm here to fix, I don't need to sell you anything. I'm really happy for you, and that's great. But for me, what I love about home health is that it's community-based. The reason that I wanted to kind of expand my horizons is because I was in one single community at one single company, and it didn't really feel right for me just to go to every different company in that community and work there. I wanted to be able to make an impact at a higher level, because for me, it all comes back to the patient experience. And home health, I think there are 16,000 home health agencies or something in the US. They all have branches in every different market. And for me, if every home health branch is forgetting about 2 patients a month, right? Which if you're at 600 census, that seems like nothing. But if you're forgetting 2 patients a month across the entire country, if I'm able to help agencies to provide that better level of customer service, to never forget about a patient, to ensure they get that timely care, I believe that in my small little segment of this process that I focus on, I'll actually, again, a leading indicator to making people's lives better. And that's why I only want to work with agencies that are really passionate about patient care, because they're the ones I can really help, because I know where their focus is. A lot of the business-minded agencies, they're already thinking about things like this, and it's all about conversion. It's all about admissions and census and revenue. And I respect that too. It's a business, but I like working with the agencies that really care about patient care, and then I can help them with what they're not the strongest at, which is this business pipeline conversion piece, and hopefully improve the patients' lives and communities across our entire country.
I mean, that's who needs to grow, are the people who care about the patients.
You just hit it on the head. So I get a little passionate about this. I want them to win.
Mm-hmm.
The agencies that care about patients, I want to do everything I can. Like, I'll reduce my fees to help them. I want them to win in every single marketplace. That alone could make such a big impact on our elderly community, which is the most overlooked and vulnerable part of our community. If we can help the agencies that care to care for more patients, that to me is like a purpose. I could get behind that and have all of my assets, all of my strengths directed in that direction. That's when it'd feel great to know that I made a positive impact on elderly people in our country.
Right. Actually, that sounds like a cool slogan for you. Helping people who care to care for more patients. That's
Yeah.
nice.
Yeah. I'm looking at my website. I need to add that.
It's so good. Well, that's our market here, like what I really like about it is those smaller agencies that I was talking about, oftentimes are clinician led. It'll be like an RN or, something like that has worked in home health for a long time, and they kind of get sick and tired of like, whatever, just the system, this, that, maybe working for a few different companies and things like that, and then they do their own thing. And they're not super business minded necessarily. They're not trying to, like, let's say, grow to this like massive level. They just want to care for patients on their own terms. They want to not be their own boss in this way, but be their own boss in that they can make the decisions that are patient first versus having to follow somebody else's whatever it is that they're unhappy with. That's what we really find with a lot of these, like, let's say, smaller companies that are going to be like 100 or less, is that they're either clinician led or they're going to be people who worked in home health in other places and just really want to be patient first. And so I really, really like that. And I'm not saying, of course, I think your system probably focuses on maybe a more medium-sized agency and not like 20 people, but I like helping those people. That's who I like to help too, because they care. It's not just a number. It's not just, they really care. And that's really cool. When you see clinicians, when you see people in healthcare that are really there to help the patient, that's awesome. And I think that's the majority of them that are really patient-centered.
It's really what I've found, which has been such a blessing, because in San Francisco, in any really competitive market, there's always the agencies that are cutting some corners and are, doing some marketing practices that we really wouldn't be okay with, that we know the Sunshine Act isn't okay with, but they're doing it. It's happening. You see the gifts in people's offices and you're like, how much was that? All I brought was a coffee for you. But that to me is really one of the things that that really kind of drives me, is the earlier on you get organized, right? And if you have an expert in a certain area who can come in and help you implement a system that works for your company, even if you're at an early stage, even if you're at 50 census, having a CRM to track what your marketer's doing, if you have a marketer at 50 census, it's it's inexpensive because it's technology, it's scalable, so it's inexpensive, and having a referral management system in place also can be a very scalable thing compared to what we're paying for EMRs. It's absolutely nothing.
Yeah.
And so to me, it almost is for those type of people, those clinical led home health agency owner operators, if you can have someone come in to help you implement some of the business side of things and just give you reports that you know exactly what they mean so that they're useful and valuable and you can see it in real time where you're at, I think it would help them get to their ideal scale. Because I think so many of those people, like you're saying, they're about taking care of patients. It's not taking over the world. It's not dominating the marketplace. It's, I want to care for as many patients as we can actually care for.
Hmm.
And that was the coolest thing for me when I was in home health is my job was to drive referrals, but my DON's job was to take care of patients. And so I would connect with her and she would say, look, it's great you're getting the referrals. We love what you're doing, but I'm not quite catching up yet. And I don't want to take even these really good referrals that you're getting because I can't do the patient care. And immediately I stopped her and I'm like, thank you. That's all I want to know. I will tell my clients the truth. It's a transparent industry. I'm not going to take a referral, say we could do it, call them 2 days later and say we can't. I would never do that because, as you know, that's the end of everything. But I would let my clients know, hey, give us a few days. We need to get through these SOCs that we have, and we want to make sure we're delivering the best care. So I'll see you in 2 days. And I had no problem doing that. Obviously, we were in a growth phase and we wanted to add more clinicians, but in an environment where that's not the case, I still think those agencies are going to win even on the marketing side. The more honest, transparent that you are, and the more that you do what you say you'll do. If you just keep your promises in home health, and I mean almost never, ever violate them, you can have whatever size business you want. You're never going to have 100% market share unless you're in some crazy county that only allows one. But, if you're one of the top 3 in most communities, you're going to have a really nice business. And you should be able to do most of what you want to live in our ever more expensive world.
I'm so happy that you exist because you are there to help the people that are doing the most good. And that's really cool. So what is your ideal customer? What are you looking for?
I mean, what I've been working with most often is actually who I'm getting the most interest from is exactly who we just talked about. It's an agency I just talked to today is at about 70 census. I've seen a lot of clients who are under 200 census, and they're not really coming to me because they want to grow necessarily. They want to be better. And so it's really interesting on that side. But what I'm interested in doing is where it's most effective what I do. Because what I do to do it the full way, to really implement a referral-to-admission system and sales and marketing strategy and all that goes with it until a patient gets to start of care. Depending on the scale of the agency, it can be a pretty large scope project and pretty expensive. So generally, if a agency is at about 200 census and they're looking to grow and they believe that they can manage 300, 400 census, that's really, I've found kind of the sweet spot where there's enough capital available to make an investment, a strategic investment that the ROI is going to be there. And your referral volume is already starting to get higher. So where I make the biggest impact is in impacted healthcare communities. So San Francisco is a good example, LA, but there are, Chicago, a lot of the major metropolitan areas where the problem of referral management is louder just because there's so much more to process. Those agencies who are at 200 to 300, who have some capital available, but who are in a super competitive marketplace. Those are the agencies that I can come in and we don't have to tweak much in my program. It's really, we can come in, do the audit, assuming that through that audit, I do find the gaps. Then we have 2 to 3 solution paths that we can go down, and they end up with a system that they're totally able to manage themselves. They have the real-time information. So that's been kind of the sweet spot. But one thing I do want to do is work with I don't know if it's necessarily going to be private equity backed, but work with a larger organization that has a footprint. Because what I believe is, even if you have 2 to 3 branches, I believe as a leader, all of your information and data should come centrally located to you so that you have one place where you can see basically how your business is running. And the weirdest thing to me is even EMRs, they're not really structured that way. Like,
They don't account for that at all.
yeah, it's like each branch is its own business. And I'm like, I know what we're saying and it's true, but we need to consolidate that data upwards. So, one of the clients I worked with, we had 2 branches. Now they're at 3 plus a hospice. For me, I like the implementing systems at scale because the value to leadership becomes so clear when you can see all of these key performance indicators across your agency in one place. And then you can break it down and look at the different agencies, and you can identify where you need to focus your coaching, your management, your attention, what teams might need some help. Is it intake that needs help? Is it marketing? Is it the communication between those two? Once you provide that data and they're sharp people who are competent, know the industry, and who want to help their team get better and help the organization perform, I am really interested at doing things at that kind of a larger scale, just because the impact is so clear. And I love all reports going up to one place personally. It's a nerd thing about me, but I love it.
Yeah.
Yeah.
So in your system, where do you see like, let's say you're working with a company, what can be something that would cause them to fail?
We talked about the right hand not talking to the left hand. That 2 culture situation that we talked about in healthcare. If the business side, if the administrative side wants to grow, and we're going to grow, and the clinical side is not on board with that, that creates a real challenge that for me, I'm kind of uniquely suited to doing that kind of conflict management, but it's not really where you're getting, I mean, it's valuable, but it's not what I want to be doing. Because we're not doing,
You don't need to do group therapy.
yeah, I was almost going to be a therapist at some point. I think I have the hairstyle for it now. I just need some glasses and then I'll be in a good spot. But I've seen it before. Administrative, the business side, we're going to grow. And then I check in with the DON or DPCS, and she's like, do you know how much we're struggling to service the patients that we have right now? And so sometimes when I make a business case to leadership, I always try and get clinical looped in as soon as possible, because if we solve this problem and we do a great job, it could create the biggest problem that our DON has ever had, and it's the worst thing ever if we're not on the same page.
Yeah, it's counter-effective because even worse than giving back the referral is taking it and then not doing a good job with it.
Exactly. Yeah. Which any great DPCS or DON isn't going to allow. Sometimes they're not in the power position, right? So sometimes it can be overrun. But I was talking with a company that's doing AI documentation for clinicians. And we were talking about their implementation strategy and how are they going to train and onboard clinicians. And I was like, one question a clinician's going to ask is, okay, this AI is doing more of my documentation. It's saving me time on charting. What does that mean? Aren't you just going to ask me to see more patients now? And because that's where my mind went. And of course, the main value proposition to the business side is increase productivity from your nurses. And I'm like, I hear what they're saying. And of course, in any business, you need to look at those kind of things. But if you're going from 6 patient visits to 8 patient visits, is the care as good? I don't know. I haven't dug into that, but it's that problem exactly where we're coming in and we're saying, hey, we're going to bring visibility, accountability, and efficiency. You're going to be able to scale your census efficiently now if that's what you choose to do. But if we have a business side that's all about growth and a clinical side that's really skeptical and just hanging on with what they're currently doing, that presents a problem.
And I've also like, maybe you've seen a different side of the industry. I've never seen a home health or like home-based hospice that people are just kind of sitting around waiting for the next thing. Everyone's at 10 out of 10, 9 out of 10, 10 out of 10 busy, you know?
Yeah, all the time. And the other place I see it is, or the other challenge I would say that doesn't help, that my system and the way that I work doesn't work well with, is if intake isn't respected for what their job actually is. So we pay intake whatever we pay them, right? But it's an administrative role. It's not performance based like the marketing team. They don't have the clinical background, so they're not commanding the salaries of nurses. You know, some 5-7 year intake may be making really good money, but you're asking a low level on the organizational chart person to be responsible for your entire revenue generation model.
Yeah.
Besides billing, of course, that's part of it. And there's a bunch, but from referral to SOC and ROC, you're asking these administrative people to do this, and you're not giving them the tools or the respect for what their job actually is. You're not helping them to save time so that they can focus on what matters. So if someone doesn't respect the intake role, it's difficult at the leadership level. It's difficult for me to work with them because I believe intake is the most undervalued part of home health, period. I think marketing's overvalued, and intake, you can do a lot with a really good intake team. If you help them to not focus on the little, if you can automate some of like insurance checking and all that kind of stuff and help them focus on talking to your referral sources and to your patients, I believe intake's the most underutilized asset that, given the right tools and the right coaching, you can build an amazing organization and have them not hate their lives and quit often,
Yeah,
which is also good.
healthcare is so like just difficult as a business because yeah, there's the business aspects, there's the clinical aspects, there's an empathy element with people suffering with their, you know, various health crises and things like that. That anything you could do to help the workers in the company is going to just magnify into the patient care and into everybody's life. So from what I'm hearing, the critical element in your system for the company's end is just buy-in from the different sides.
Yeah.
And that makes sense. That's all consulting, I guess.
Yeah, because the system works and there's points in the system. If we get to the audit and I can't find, usually it's about 10% minimum that they're just not seeing that's falling out of their referral funnel. If there's nothing there and there's no problem for me to solve, the project stops there. Unless they want some sales and marketing support. But if their system is working at their scale, they're okay for now, and we don't have to implement something that's going to be scalable and ready for the future and adapt to everything. Then they're good. So there are those kind of checkpoints in what happens, but when there's buy-in and some awareness, again, it's not exactly a problem per se because the pain isn't there, but if there's awareness of that and a desire for visibility, clarity, to just know the truth of what's happening in your business, those are the people I work the best with. When you aren't afraid of accountability at the leadership level, because that's another thing. If you're a regional manager and someone like myself comes in and says, hey, we're going to give exact reports on exactly your performance levels from referral to admission and your salespeople, are their visits translating to, some people are like, I don't want that.
Yeah.
I got my bonus last year and I don't even know how well I really did, you know? So, fear of accountability is another challenge that I've seen people experience. But for me, I want the truth in the relationships that I have. But in business, you want to know what's really happening at all times, or you're going to get caught from the side and it's not going to be good.
Oh, yeah. Especially the larger you get. So you guys focus on the intake process, like I guess referral to intake, this whole section. Where does your system end? Is it at start of care? Is it how far does your system go into the clinical care process?
Yeah, the ideal system for me starts at the marketing level. So it tracks everything that's happening with the marketers, community liaisons out there to referral all the way through to start of care scheduled. And ideally, in a system that I develop, if a company has the budget, we're automating that part of the process of the referral from our system, the chart being created in the EMR, because I really want to save intake people time. So, but basically, once that's in there, that patient referral just, it lives in our system and in the EMR, but nothing else happens with that unless that patient goes back to the hospital and then they're a resumption. Then our system needs to ping and say, hey, this was a resumption of care. This isn't a new referral, and bring awareness to that, because sometimes processing ROCs is its own challenge.
Can you let people know how they can get in touch with you if they're interested in your services?
Yes, LinkedIn is kind of the best place for me now. The company is HHA Pros, like Home Health Agency Pros. And so on LinkedIn, that's the best spot. I'm not really big on other social media platforms. And then Austin at hhapros.com. If you have any questions, concerns, thoughts, anything that, if you heard the podcast and wanted to talk more, learn more, or any of that kind of stuff, I'd welcome any kind of conversations like that.
Perfect. And we'll make sure that we link all your info so that people can easily get in touch with you. It's been a pleasure talking to you. And again, this is Austin Degenhardt from HHA Pros Consulting. And I'm Mariam Treystman from the Home Health Consultant. Thanks, guys.
Thanks so much, man.
Bye.